Lung cancer is a condition where cells grow in your lungs that are not supposed to be there, that can aggressively take over normal tissue in the lungs and can also travel throughout the body and aggressively take over normal functioning of the body. It's no different than any other cancer like in the colon or the pancreas or the breast. The main thing is not to smoke, and I think also to know your family history. If you have a genetic presupposition for it, then you should probably know you shouldn't be smoking if your other family members have had cancer. The other thing is if you think you might be environmentally exposed to something like radon, to get testing. Lung cancer can actually be very quiet. It's a quiet killer. A lot of the initial signs and symptoms are nothing. You're normal. Unfortunately, the majority of lung cancer patients come in because they're having problems. You don't go to the doctor and say, hey, there's nothing wrong with me, but check me out. Most of the time you go to the doctor because you've got a problem. You're short of breath, or you're coughing up blood, or you have a chest pain, or you can't move your arm anymore. That's unfortunately when people come in with lung cancers, that it's grown so big that it's now interfering with normal structures. And people come in complaining about it. And that's one of the problems with the mortality of lung cancer, is that people are coming in late stages because it's quiet until it's not quiet anymore. We've known since the 1990s that using CT scans or computed tomography scans or CAT scans at a very low dose can actually save lives. It wasn't until about 3 to 4 years ago that the government actually realized that it's worth paying insurance to do lung cancer screening. So now you can do low-dose lung cancer screenings once a year if you meet certain criteria. So you need to be of an age between 55 and 80. You have to have what's called a 30-pack smoke in your history, which basically equals out about a pack a day of cigarettes for 30 years or more. And you have to have been smoking at least greater than 15 years. If you stop smoking less than 15 years, you fall out of that category. If you find lung cancer at a very early stage, it's way over a 90% survival rate. Once it starts getting larger and travels outside of the lungs, the chance of someone dying within 5 years significantly increases. There are subgroups that are very concerning. Young women who have never smoked is a category that's very concerning. It's about the 7th leading cause of cancer death. So to put it in perspective, nationally, lung cancer is the #1 killer among cancer, period. Listen to this. It kills more people than breast, colon, rectum, pancreas, ovary, prostate combined. My advice is don't put any kind of smoke in your lungs. E-cigarettes, vaping, cigarettes, tobacco smoke, stay away from it. And I think that's the best that is going to help you long term for your lungs.